Hey everyone, my name is Nyana, and today Rachel and I will be talking about the social and emotional impact of postgraduate depression in early adulthood. First, let's go into a bit more detail about what postgraduate depression is and how prevalent it is in our society. Postgraduate students are at a high risk of depression. The prevalence of depression symptoms vary from 6.2% to 84.7% among this demographic. Young adults have the highest rate of behavioral problems, but the lowest perception of risk and least access to preventative care and treatment. Life after college, as we all may know, can be very uncomfortable. Young adults are stuck in this in between stage where you're leaving your old way of living behind and stepping into a new one. A lot of changes are happening, and you start to question a lot of things. You begin to strip away your old identity that family, friends, or even society has placed on you, and you start to think more about yourself, your true wants, and needs. While trying to find yourself, you also have to juggle all of life's responsibilities, such as finding and starting a job, finding a home, maintaining relationships, and sometimes even taking care of children, while still trying to take care of yourself. On top of that, life after college may not be what you expect it to be. Adults may have a vision of what they thought life would be like, and when that dream isn't delivered, it can cause intense emotions of sadness, which can lead to depressive episodes and isolation. The COVID-19 outbreak has also magnified the anxiety and the stress and depression that post college life can bring. The pandemic has tremendously affected this demographic of post college graduate students. From them losing many bonds and relationships due to isolation, as well as losing a lot of job or internship opportunities because of the downsizing of businesses. Having theory defined developmental stages and tasks pertaining to each stage. Within each stage is a list of tasks that individuals feel that they must complete. According to his theory, some of the tasks are achieving autonomy, trying to establish oneself as an independent person with a life of one's own, establishing identity, more firmly establishing likes, dislikes, preferences, and philosophies, developing emotional stability, becoming more stable emotionally, which is also considered a sign of maturing, establishing a career, deciding on and pursuing a career or at least an initial career direction, and pursuing an education, finding intimacy, forming first close long term relationships, and becoming a part of a group or community. Young adults may, for the first time, become involved in various groups in their community. According to having hers, if a person completes the correct task in the time frame, they will feel happy and accepted by society. On the other hand, if they fail to complete these tasks, it will lead to a more unhappy individual and feeling out of place.
So, some college specific developmental needs is that many college students become isolated while in college, either due to the stress and depression symptoms greatly increasing from the increased workload, both academically and financially, that people are faced with, as well as the new social situation where you are losing and gaining friendships in the transition from uh, high school to college and from college on. This is also the time where the social clock, the age graded expectations for major life events, truly becomes the individual's decision, where moving out and crafting the new friendships and becoming your own person really becomes fully relevant during this time period. And this is where people deviate from the path set out for them, particularly from the transition from K through 12, where you have minimal personal decision in what you're doing, versus college, where you start to get that full freedom, and especially after college. And that transition can be very stressful for many people. as well as messing up your circadian rhythm in college has a negative impact on the switch to full-time work, as your sleep-wake cycle is off from your circadian rhythm. So switching from the many sleepless nights, staying up and doing essays at 2 o'clock in the morning does make the transition to 9 to 5 work very hard, as your body is not used to waking up at that specific time anymore. So some interventions that are common with postgraduate depression and then depression in general, or depression and stress in general, is many people self-medicate by consuming alcohol to reduce the depressive symptoms. Studies have also shown that people tend to outgrow the dependence on alcohol, but there is a increased likelihood of, if you become dependent on alcohol in college, to have an increased likelihood of depending on alcohol after college is done. Studies have shown that stress management interventions have had a significant impact on stress and anxiety, but there are only significant impacts when looking at depression if the intervention is designed specifically for depression. And this just means that just general de-stressing techniques do help reduce stress and anxiety, but for depressive symptoms is only interventions that are specifically targeted for depression are able to impact depression in any significant way. Interventions also work better if they're in the medium to long term rather than the short term. So making the bigger, more impactful interventions do help better rather than just quick fixes. Preventative sleep regulation during college help reduce the possibility of depression after college. So again, keeping your circadian rhythm in one piece does tend to help with reducing the possibility of depression after college.
One of the most proven counseling strategies for depression would be cognitive behavioral therapy, or other known as CBT. The overall goal that comes from CBT is that people suffering from psychological problems can learn better ways of coping with them. CBT treatment usually involves efforts to change thinking patterns, such as learning to recognize one's distortion and thinking that are creating problems, and then learning how to reevaluate them in the light of reality, gaining a better understanding of the behavior and motivation of others, using problem solving skills to cope with difficult situations, and learning how to develop a greater sense of confidence in one's own abilities. CBT treatment also involves efforts to change behavioral patterns, such as learning how to face one's fears instead of avoiding them. Often, role play is involved to prepare for potentially problematic interactions with others. And CBT also helps one learn how to calm their mind and body. CBT places an emphasis on helping individuals learn how to be their own therapists through exercises in the session, as well as homework exercises that can happen outside of the sessions. Patients are helped to develop coping skills where they can learn how to change their own thinking, their problematic emotions, as well as their behavior. During this treatment, therapists that implement CBT emphasize what's going on in a person's current life rather than the difficulties that have led up to it. A certain amount of information about one's history is needed, but the main focus of this treatment is how can you move forward and learn how to develop more effective ways to cope with the stressors of life. Also, building a stronger relationship foundation with peers and a personal support network helps to mitigate the stress levels and depression symptoms of graduates. Joining support groups will not only have a person gain that sense of community that they really crave, but also it'll allow them to feel less lonely, isolated, or judged. You also get to learn how to express yourself verbally, openly, in front of people. Because a lot of times we tend to bottle things up, or, oh, it's not that big of a deal. You kind of push it to the side, and it eventually becomes too much to manage.
So some legal and ethical considerations is there are naturally some issues with the survey pool. Is a lot of the data collected was self-reported online information, so the validity and reliability of that information isn't fully verifiable because it is online, so you can't fully verify that the information is correct, as well as could be some false recall where people create or forget memories, so the symptoms may not be what they actually were. And people also tend to minimize the severity of their symptoms because they don't want to seem as though they were worse off than they actually were. So that also messes with the data. And unfortunately, the participants studied were primarily white upper middle class women. So it is hard to generalize outside of that because women, unfortunately, are more likely than men to reach out and get the information or the intervention help. And even though that the trend of men reaching out and getting help is increasing, it is still at a severe deficit. Another aspect is that secondary education is a necessary part of society's career path. So we can't exactly tell people to stop going to college just because it's stressful and it doesn't have the exact social reward that we hoped it would be. Another aspect is that stress is not a diagnosable condition, so it's hard to qualify what the definition of high stress is, because we can measure things that are related to an increased stress, but there is not a specific, direct, measurable way to measure stress, so it is hard to quantify what is a high stress situation, because what impacts one person may not impact another as equally. So some further research more research needs to be done on the long-term solutions rather than the quick fixes of getting a day off or breathing for a few minutes. More studies need to be done on non-college students, even though undergraduates are an easier and more convenient way to get participants. More effort needs to be done into getting people who aren't in college to answer questions, because that skews our data because we're only looking at primarily undergraduate students, and we need to reach out to a greater audience. And as such, we also need to reach out and gear some interventions towards the male population in order to reach them, so it isn't primarily focused towards women. Interventions also need to branch into a more creative territory, such as music and art therapy, because we have a lot of research on a lot of clinical interventions, but we don't have a lot of research into some more creative outlets, so that it isn't primarily done from an academic standpoint, and maybe the more creative outlets may have a further impact, but at this time there hasn't been much research into those areas.
And that concludes our presentation. Here are our references that Rachel and I utilized for this PowerPoint. In conclusion, just to summarize everything, post-graduation is a time of intense change where depression can occur. While this can feel like an overwhelming and discouraging time, there are ways that people can heal and move forward into the next phase of their lives. With all that being said, we'd like to just thank you guys for tuning in, and we hope that this was an informative presentation for all of us.